This conference is being recorded.
Okay. Bonjour et bienvenue à cette conférence de presse. I'm Elizabeth Thompson with CBC News. With us today, we have the Health Minister, Mr. Duclos, who is with us in person, and we have Dr. Theresa Tam, Chief Public Health Officer, who is with us online or virtually, and Dr. Howard Njoo, who's the Deputy Chief Public Health Officer, and they will be speaking to us about COVID-19. Minister?
Merci beaucoup et bonjour tout le monde. Good morning, everyone. Merci de vous joindre à nous aujourd'hui. Thank you for being here. Today, I will proceed with an update on the COVID-19 situation and more specifically with the Omicron variant of concern. Comme vous le savez, notre gouvernement a rapidement mis en place des mesures pour ralentir la propagation de ce variant au pays. Nous voyons toutefois que dans de nombreux pays à travers le monde, la situation s'aggrave et que les cas se multiplient. Countries around the world are seeing or projecting an important rise in the number of cases. Dr. Tam and Dr. Njoo will speak to this as part of their modeling update in a few minutes. As a government, our objective is simple. We want to protect the health and safety of Canadians and protect the gains that we have made in the fight against COVID-19 over the last 20 months. This is why we have put into place new measures to mitigate, import, and slow the spread of the new variant in Canada. It's important to keep in mind that these measures might change as we adapt to this evolving situation. Comme nous l'avons annoncé le 30 novembre dernier, nous sommes en train de graduellement augmenter notre capacité de tester les voyageurs à leur arrivée aux aéroports canadiens. As announced on November 30th, we are gradually ramping up our testing capacity at international airports. Today, I would like to provide you with a brief quantitative update of that increasing testing capacity. On November 30th, our capacity for all air travelers from all countries was of 11,000 tests per day. As of yesterday, December 9th, that capacity has increased to 17,000 tests per day. The end state to test all non-US air travelers is a capacity of 23,000 nationally. We are therefore halfway. At the Vancouver International Airport, we've gone from 2,080 tests per day on November 30th to a capacity of 3,130 tests per day on December 9th. At the Calgary International Airport, we've gone from 910 tests per day on November 30th to 1,460 tests per day on December the 9th. At the Toronto Pearson International Airport, we've gone from 5,232 tests per day on November 30th to 8,317 tests capacity per day on December the 9th. At the Montreal Trudeau International Airport, we've gone from 2,128 tests per day on November 30th to 3,033 tests per day on December the 9th. Je vais maintenant répéter tout cela en français. En date du 30 novembre, notre capacité de test aux aéroports canadiens, capacité totale pour tous les voyageurs aériens de tous les pays, était de 11 000 par jour. Nous en sommes maintenant à une capacité de 17 000 tests par jour, une augmentation d'un peu plus de 50 %. La capacité nécessaire est de 23 000 par test pour tester tous les voyageurs aériens de pays autres que les États-Unis. Nous en sommes donc à mi-chemin. À l'aéroport international de Vancouver, nous sommes passés de 2 080 tests par jour en date du 30 novembre à 3 130 tests en date du 9 décembre. À l'aéroport international de Calgary, nous sommes passés de 910 tests par jour en date du 30 novembre à 1 460 tests en date du 9 décembre. À l'aéroport international Pearson de Toronto, nous sommes passés de 5 232 tests par jour en date du 30 novembre à 8 317 tests en date du 9 décembre. À l'aéroport international Trudeau de Montréal, finalement, nous sommes passés de 2 128 tests par jour en date du 30 novembre à 3 033 tests par jour en date du 9 décembre. On le voit, notre capacité de tester augmente de manière significative, mais elle demeure encore incomplète. As you can see, our testing capacity is increasing steadily and significantly, but it still remains incomplete. In order to further increase our capacity quickly, we've awarded contracts to private companies, providing us with additional testing and processing services. These companies include Switch Health, Life Labs, and Dynacare. Ces compagnies vont nous aider à augmenter notre capacité à tester les voyageurs à l'arrivée jusqu'à ce que nous puissions tester tous les voyageurs ciblés, comme nous l'avons annoncé le 30 novembre dernier. Once again, to anyone who is planning to travel, I will say this: you need to plan ahead. Be prepared for airport delays, have a quarantine plan, and be sure to use the ArriveCan application or website to submit your information before you arrive at the Canadian border. You should also be prepared for officials to follow up with you to make sure your COVID testing is complete. The goal of these measures is, and always has been, to protect the health and safety of all Canadians. Par ailleurs, mercredi, j'ai tenu une autre rencontre avec mes homologues des provinces et des territoires afin de les informer de l'évolution de la situation. On Wednesday, I met with my provincial and territorial counterparts and provided them with another update on the ongoing situation. Over the course of the pandemic, our government has made significant investments in order to build testing capacity with the provincial and territorial healthcare systems. Through the Safe Restart Agreement, we have transferred over $3 billion to provinces and territories for testing and contact tracing. The federal government has also purchased 95 million rapid tests and shipped 86 million rapid tests to provinces and territories. Depuis le début de la pandémie, notre gouvernement a réalisé des investissements significatifs afin de permettre aux provinces et aux territoires de développer davantage leur capacité de dépistage et de traçage. À travers l'entente pour une relance sécuritaire, nous avons directement transféré plus de 3 milliards de dollars aux provinces et aux territoires. Le gouvernement canadien a également procédé à l'achat de 95 millions de tests rapides, dont 86 millions ont été livrés directement aux provinces et aux territoires. Comme vous le savez, toutefois, les demandes des provinces et des territoires pour ces tests rapides ont augmenté dernièrement rapidement. Pendant plusieurs mois, ces tests étaient largement sous-utilisés, mais pour le mois de décembre, les provinces souhaitent en recevoir autour de 35 millions. Cela représente à peu près 5 fois la quantité moyenne de tests utilisés au cours de la dernière année. Il s'agit d'une excellente nouvelle et comme nous l'avons toujours fait depuis le début de la pandémie, nous allons répondre aux demandes des provinces et des territoires et nous assurer que ces tests soient livrés à temps pour la période des fêtes. As you know, provincial and territorial demand for rapid tests is growing. For the last year, these tests were largely underutilized, but for the month of December only, provinces and territories have requested around 35 million tests. This is very good news, and we will ensure that provinces and territories get these tests in time for the holidays. Finally, I would like to take a moment to come back to the National Advisory Committee on Immunization's recommendations from last week. As clearly stated by NACI, booster shots are safe and an effective way of enhancing our collective level of protection against the virus. I encourage all Canadians to get a booster shot as soon as it is possible. In our meeting on Wednesday, I reassured my provincial and territorial colleagues that the federal supply of vaccines is ready and available for them to use. Finalement, j'aimerais revenir rapidement sur les recommandations du Comité aviseur national sur l'immunisation. Tel que clairement indiqué par le Comité, les doses de rappel sont un moyen sûr et efficace d'augmenter notre niveau de protection collective contre le virus. Tous les Canadiens âgés de plus de 18 ans peuvent maintenant commencer à recevoir cette dose de rappel dès que possible, conformément aux recommandations du Comité. In closing, I want to take a brief moment to take stock of the formidable progress we've made over the course of the last 20 months. It's been tough for all of us, et nous ne voulons pas revenir en arrière. The Omicron variant of concern is a cruel reminder that the global epidemiological situation can change quickly. We all need to be prepared for that as well. At any given time, we may need to change gears, adjust our plans, or change our behavior to meet the needs of the moment. That goes both for individual Canadians and for their governments. Canadians who are thinking of traveling abroad need to be warned that the situation abroad is both risky and unstable. They should also know that returning to Canada will likely involve delays and hassle. Je vais maintenant me tourner vers vous pour toute question ou commentaire avant d'aller vers la présentation du Dr. Njoo et de la Dr. Tam.
Thank you very much, Minister Duclos. As you mentioned, Minister Duclos will be taking questions for about 30 minutes. Then Drs. Tam and Njoo will present the modeling, and then they will take questions specifically on the modeling. Those who in the room who would like to ask a question will go to the microphones, and then after that we will go to the operator and people joining us by phone. First question, and when I call on you, can you tell me your name and your media organization? Mike to my right.
Bonjour, Louis Blouin de Radio-Canada. Monsieur Duclos, j'aimerais vous entendre sur les cibles de dépistage dans les aéroports. C'est quoi votre objectif? Quand aimeriez-vous avoir atteint ce chiffre de 23 000 tests par jour?
Mais très bien. Et je rappelle rapidement où nous en étions et où nous sommes et où nous devons aller. Donc, nous étions lors de l'annonce à 11 000 tests dans tous les aéroports canadiens pour tous les voyageurs, y compris ceux qui viennent des États-Unis. Nous en sommes maintenant à 17 000, donc une augmentation d'environ 50 %, et nous avons besoin d'atteindre le 23 000 le plus rapidement possible. Et c'est pour ça que les informations que j'ai données il y a quelques instants sur les opérations d'approvisionnement auprès de fournisseurs particuliers vont nous aider à atteindre ce seuil de 23 000 aussi rapidement que possible. Ce que j'ajouterais, c'est que ces chiffres n'indiquent pas peut-être totalement l'importance des progrès qui ont été faits au cours des derniers jours. Parce que, si je peux me permettre, là, comme vous savez, j'aime beaucoup les chiffres. Donc le 11 000, c'est la somme de tous les tests faits dans les aéroports canadiens. Mais de ce 11 000, il y en a à peu près 3 000 qui étaient spécifiques aux voyageurs aériens d'autres pays que les États-Unis. Et c'est sur ces voyageurs-là que nous investissons nos efforts. Donc, nous sommes partis essentiellement d'une base d'à peu près 3 000 et nous avons déjà ajouté à peu près 6 000 à cette base de 3 000, ce qui est une augmentation très significative. Il nous reste un autre 6 000 à ajouter pour atteindre le résultat final.
Donc, est-ce que là-dessus, j'aimerais savoir, est-ce que vous visez une question de jours, de semaines, de mois pour en arriver là? Deuxième question, il y a un changement de dynamique que pourrait amener le variant Omicron. On le sait, il y a des scénarios qui vont nous être présentés. Il y a des gens qui sont en train de planifier le party de Noël. Il y a des gens qui sont en train de décider s'ils annulent leur voyage dans le Sud. Votre message, c'est quoi à la lumière du variant Omicron? Est-ce qu'on rapetisse les fêtes de Noël? Est-ce qu'on évite de se déplacer? Est-ce que vous pouvez envoyer un message clair là-dessus sur ce que vous conseillez aux gens?
Et deux choses ici. La première, sur la situation au Canada. Vous allez voir, évidemment, dans quelques instants, lorsque les docteurs Tam et Njoo vont nous donner pour le portrait actuel et prochain. Et là-dessus, bien, on sait qu'on observe là, que les cas actuels, y compris au Québec, là, ce sont des cas reliés au variant Delta. Et le variant Omicron est pour l'instant très peu présent au pays. Mais ça, c'est parce que, entre autres, là, évidemment, nos opérations à la frontière, avant l'arrivée et après l'arrivée, fonctionnent. Elles ne sont pas parfaites, évidemment. Les tests sont imprécis, donc les gens peuvent quand même transmettre le variant quand ils voyagent au pays en raison de l'imperfection des tests. Et donc, c'est comme ça. Mais la situation, donc on a à peu près 80 cas d'Omicron au Canada. C'est pas ça qui, évidemment, là, explique les augmentations importantes de cas à tous les jours au pays. Alors, ce sont des mesures de santé publique habituelles pour limiter la transmission communautaire qui sont importantes. Évidemment, au Québec, on a présentement le taux de nouveaux cas le plus élevé au pays. Le gouvernement du Québec fait son travail correctement. Nous rassure en nous disant que le taux d'hospitalisation est sous contrôle essentiellement, mais il faut être évidemment vigilant parce que il y a généralement un certain délai entre la transmission et l'évolution des maladies et donc des hospitalisations. Ça, c'est sur le plan domestique. Sur le plan international, la situation évolue très rapidement. Et c'est ça que mon message principal aujourd'hui, c'est plus sur la situation internationale. Les voyageurs, les gens qui pensent voyager dans les prochaines semaines doivent savoir que à l'échelle internationale, les choses peuvent rapidement changer. En Europe, si vous suivez un peu les chiffres, ça devient très compliqué dans plusieurs pays. Il y a des pays même qui sont en train de demander aux élèves de rester à la maison parce que la situation se détériore trop rapidement. Dans certains cas, on rappelle, on invite les gens à faire du télétravail alors qu'ils avaient commencé à retourner au bureau. En gros, ce que j'essaie de dire, c'est que internationalement, c'est critique. En peu de temps, ça peut évoluer. Et ce que j'essaie de dire aussi aux gens, ce qui est important que les gens comprennent, c'est qu'au retour au pays, les choses aussi peuvent évoluer rapidement. Et ils doivent s'attendre à que ce soit beaucoup plus compliqué de voyager à l'étranger et plus compliqué aussi de revenir au pays avec les tests et les quarantaines obligatoires qu'on est en train de mettre en place.
Okay. Mike to my left.
I'm saying good morning, Minister Duclos, Krisanashkate, CTV National News. Minister Marcy Ian is self-isolating at home after coming into contact at a gala in Toronto with people who have since tested positive. Should MPs and cabinet ministers be attending these large events given the rising case numbers? And have you had any contact with her on Parliament Hill this week, either in the House or at caucus?
Well, the answer here is that every Canadian, and certainly all parliamentarians, need to abide by the public health measures. Obviously, there are people who would naturally be more exposed to more people, and that's certainly the case of parliamentarians and public officials, including journalists. But whatever our role is in society, we need to be following public health advice. And when there is a risk or a likelihood that we have been in touch with someone infected, we absolutely need to follow the right public health guidance.
But you haven't been in contact with Marcy Ian at all?
Well, I will have to check the details of that story, and I can come back to you.
It costs around €1 for a rapid test. In Ontario, it's $40 at Shoppers. Are you disappointed that provincial governments have not made the rapid tests you've given them more affordable and available for Canadians?
Well, we know it's been challenging for provinces and territories over the last year, and there's certainly no intention for me and for us here at the federal level to blame anyone. Experts have, however, said that we could have used rapid tests more often. This being said, experts also tell us that these rapid tests need to be used in a particular context, in a particular manner, in order to understand what they really can and cannot do. And two things that rapid tests can do quickly, and therefore things that rapid tests cannot do. The two things that rapid tests are quite good at is to provide what we call surveillance activities. So if in an environment like a school or hospital, a community center, a factory, there is no apparent sign of COVID-19, but we still want to be double certain, because it's a large community, then rapid tests are useful because they screen a lot of people rapidly and they get very ample results of whether there might be community transmission or community occurrence within that particular context. Now, the second thing that the rapid test can do is if you feel symptoms and you want to have a rapid check of whether these symptoms are symptoms of COVID-19, and you take that rapid test immediately, and in 15 minutes you get the result. Now, if that result is negative or positive, doesn't matter. If you really feel symptoms that you may be contaminated with COVID-19, you need to take what is called a molecular or PCR test to validate that. But it gives you a quick idea of whether you should take immediate actions to isolate from others. So that's a useful tool, but not a complete tool, because you still want to be double certain by having a very precise molecular test. So these are the two main purposes for which the rapid test can be used.
Oops. Ashley Burke, CBC News.
Good morning, Minister Duclos. Same sort of question on the rapid tests. We're just hoping to find out, will the federal government continue to give rapid tests to provinces who are not distributing them widely and also freely to citizens?
Well, we've been providing these tests free, and we are continuing to do so. We are also multiplying by 5 just in December the average delivery of rapid tests over the last months. So this is, and that's great. Now we've been able to answer a relatively recent request from all provinces and territories to speed up the delivery of rapid tests. Now, so fortunately, we are able to do that, and in fact, match exactly the demand of PETs and provinces and territories for December, and we'll continue to do what we can to match further demands in the new year. This being said, how rapid tests are used in Canada in specific provinces and territories, that depends on the conditions and I would say priorities of provinces and territories. Like in Quebec just this morning, listening to the radio, in my home city of Quebec, I was hearing that they were, and that's great news, they were distributing the rapid tests in daycare centers. In Ontario, they've been distributing them in schools and universities, I understand. In Saskatchewan, they've been making them available directly, I believe, through pharmacies to the general population. So there are different models that have evolved in Canada over the last few weeks. And what I hear from my colleagues, what I heard from them on Wednesday, is that they are looking at each other and trying to see what works best. No, they don't need to work in perfect synchronicity, but I think they're looking at each other and trying to do as well as the others are doing, taking again into account that they have different conditions, different partnerships, and different priorities.
But as you stated in your opening remarks, there have been a lot of unused tests in provinces and territories as well. What is your message to those regions who are not distributing them more widely?
My understanding is that, yes, there has been a significant amount of unused rapid tests for a relatively long period of time, but at this particular date, at this particular period in the history of COVID-19, so at this time now, the stocks in provinces and territories are relatively low, and that's why the delivery of these 35 million rapid tests is going to help.
Okay, Mike to my left.
Good morning, Tessie Sanchi with Hill Times Research. Minister Duclos, excuse me. I'd like to ask you about a separate matter that affects your office, which is drug pricing regulations that are supposed to be in effect on January 1. Your government has already delayed them 3 times. Can you say today on December 10 that those drug pricing regulations will be in effect on January 1, 2022?
Well, what I can say now is that we are obviously mindful of this important issue. I've been obviously in touch with some of the important stakeholders, including provinces and territories with which we need to work. and I will hopefully have something soon to say on the matter.
So you're not committing to them being in place on January 1, 2022. What would you say to stakeholders? It's been a bit of a hamster wheel, especially the last 2 delays. Folks have been getting notice 2 days, 2 or 3 days, excuse me, before the rules are supposed to be in place. What would you say to stakeholders who are just frustrated, whether they're for the rules or against the rules? They're not sure up until a few days whether or not there will be different rules in place.
Well, we understand, and I certainly understand that is a very important part of our overall efforts to reduce the costs and increase the access to medicines across Canada, including obviously the more costly medicines that have tended to emerge over the last years, almost all of them patented. So it's obviously an important piece of the agenda around making medicines less costly, more accessible, and also addressing the serious long-term challenges that we face in sustaining our healthcare expenditures over the next years. But I'll have more to say, hopefully as quickly as is feasible.
Okay, Mike Lecouture, Global News.
Still introduce myself, if that's okay, Elizabeth. Mike Lecouture with Global News, Minister. Good to see you. I wanted to ask you, in light of what we're seeing with Omicron, not only around the world, but here in Canada, what is your advice to Canadians who are sitting around saying, I was promised that I can travel if I get double vaccinated, and I was promised that I can gather if I get double vaccinated? What are you going to tell Canadians? What is your message to them today about holiday travel and holiday gatherings?
Maybe I should turn to Dr. Tam, or Dr. Njoo, who always say these things with greater eloquence and sometimes greater...
I'm sure they'll get the question later.
Okay, well,
since you're here, I thought I'd ask you.
Very good. No, because I wouldn't want you to feel that I'm forgetting about Dr. Tam and Dr. Njoo, but that you are telling me that you won't forget about them. Now, what we can tell Canadians is something that they've known since the beginning of COVID-19. COVID-19 is a virus and then a disease over which we have learned many things over the last 20 months, and that's going to be the same with a new variant. And the new variant tells us that we need to be even more vigilant when, in particular, we think about traveling outside of Canada. As we said earlier, Omicron is not yet prevalent in Canada, has limited community transmission. That is going to change. And you'll look at the modeling of Dr. Tam and Dr. Njoo in a moment. You'll see how it could change relatively quickly. But it's not, the community transmission of Omicron now is limited, and therefore it's not, domestically speaking, what people should think about when they plan their holiday opportunities with friends and families. However, if they think about traveling outside of Canada, Omicron should be a big red part of their radar screen. It should be flashing, because things are happening very quickly outside of Canada. And so if they think of traveling, that should be a serious alarm bell, a serious concern for them, because it's not only about coming back to Canada, and when they come back to Canada, they should expect delays and hassle. That's going to be it, because we're going to do what we need to do to protect the health and safety of Canadians at airports. But they should also be mindful that it's going to be uncertain and risky to travel in a number of other countries over the next weeks, given the serious increase in the incidence of Omicron that we are seeing abroad.
I also want to follow up on the rapid tests. In one case, you had said that they've gone largely unused. You also said that you don't want to blame the provinces and territories for not using them, yet the federal government has delivered nearly $100 million to the provinces and territories. They're going largely unused. How can you not blame the provinces and territories for not using something that you have handed to them as a federal government to use more widely? Because they, as I said earlier, they have had to focus on priorities such as, vaccination.
and looking after the healthcare system, and the use of the most precise testing procedure, which is the molecular test. Now, when you have significant prevalence of the virus in a particular environment, molecular tests, that's what you need to use because you don't want to miss anyone. So molecular testing has been until now probably the most important type of testing that we could use, because to protect the health and safety in environments where there is a lot of COVID-19 incidents, that's what you absolutely want to focus on. But now we've been moving to a different level of community transmission for some time. Obviously, things are changing in some of the provinces right now. But with that, we are now, in most provinces and territories, better able and certainly better guided to use the rapid test in appropriate circumstances.
Okay. Mike to my left.
Laura Osmond, the Canadian Press. Thanks so much for taking our questions this morning. My question is about this testing and mandatory quarantine policy for incoming travelers. The government's social media posts have been saying you will have to quarantine, you will be tested at the airport, as if this policy is fully enforced. You're saying we're only about halfway to the capacity that we need to fully enforce that policy. It's creating a lot of confusion for people who are worried about consequences for not following the rules when they don't really know what the rules are before they get to the airport. So what certainty can you give to people? What is their experience going to be if they're traveling in the next few weeks?
Well, there is one certainty, which is that the Canadians should expect to be tested and quarantined when they enter Canada through an airport from a place other than the United States. And they should expect that because, as we said earlier, we've made, not only was that present before November 30th, now I spoke about the 3,000 daily tests that air travelers were being administered randomly, but we've moved from that relatively small base, 3,000, and we've added 6,000 more tests, and we need to add another 6,000. So 3 plus 6 plus 6, plus 6 already, and 6 coming. That's, I think, will tell Canadians that the likelihood of having to be tested and quarantined when they come back into Canada, that likelihood is increasing quickly. Now, what they should also do is always listen to the directives of border officers and PHAC officers when they enter their particular point of entry into Canada.
I also want to ask you about domestic measures. I know we're not speaking about the modeling yet, but we can imagine that the effect of Omicron on our domestic case count could be very dramatic. And so you've been speaking with your counterparts at the provinces. I'm wondering, when this becomes no longer an international issue, if the Omicron variant does take hold in Canada, as the modeling no doubt predicts it could, what kind of domestic policies are you looking at with your fellow ministers in the provinces to limit the spread here?
Until now, and Dr. Tam might step in if you want, if you allow that to happen. Until now, the public health measures that have been understood and applied for almost 20 months now remain exactly those that we need to follow with the new variants. Social distancing, personal protective equipment, washing hands, watching symptoms, being tested if we've been in contact with someone possibly infected, or if we have symptoms. So those are the fundamental public health measures that I understand need to continue as long as the variant, the virus is with us. I might turn to Dr. Tam just to say whether Dr. Tam have said something that he would have said otherwise.
Yeah, we know the public health measures that do work, and they will work against any variant. But we will go into things in a little bit more detail later.
Thank you very much. Now we're going to go to the phones. It'll be one question, one follow-up, and the shorter the questions and the shorter the answers, the more people we can get in, because Minister Duclos does have a plane to catch. We want to get as many people a chance to ask a question as possible. Operator?
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good morning, Minister. Thanks for taking our questions. I just wanted to follow up on just one data point. You said today that testing capacity has increased 50%. Earlier this week, you were saying 60%. So just to clarify, so it is now 50%. And to Louis Blouin's question, when are we actually going to be fully there? You're saying these are necessary steps. So when are we actually going to have that fully in place? Will we be able to have it fully in place?
Thank you. And I understand that these percentages can be confusing. The overall, there are two pieces. The one piece is air travel. The other piece is land travel. So if we add land and air travel together, all the tests at land and at airport, as we said earlier, we need to increase that total testing capacity by 60%. Now, if we focus only on air travel, we were at 11,000 on November 30th. We're now at 7,000, so it's an increase by about 50%. We need to go to 23,000. That's for just air travel test.
Marika, do you have a follow-up?
Yes, I do. Thank you. So going on to your comments about travel being risky and unstable, or that the situation abroad is both risky and unstable, I think it's the terms that you used. Are you planning to change the advisory that is currently in place that Canadians who are fully vaccinated can travel? You seem to be strongly warning against travel, but the official advice appears unchanged. So can you just clarify which advice Canadians should be following? Is it safe if you are fully vaccinated to travel, or will the government be changing its formal advice?
The advice that we're using is a combination of the advice of public health officials within Canada and that the advice coming from international partners, including the advice that comes from informational flows that they transfer to us, so we understand better, obviously, the situation outside of Canada when we have great collaboration with our partner countries on what they see on the ground. So it's a combination of what experts here tell us and what we hear from others outside of Canada. So it's a combination of these two, and the resulting advice to Canadians therefore changes as the situation evolves. The main advice is to be extremely prudent when it comes to thinking about traveling outside of Canada. We're not currently advising Canadians not to travel. That could come, and if it does come, it will have to come through a combination of different input, as I said, in different sorts of advice. But what we see now, what we hear now from public health officials in Canada and from the international context, is that people need to be very aware that traveling outside of Canada, as I said, comes with risk and uncertainty, and things can change quite rapidly.
Next question, operator. And if I am serious about if people can ask questions quickly, then we will be able to get more people in, because unless the minister can stay later than I've been told, we've only got 5 minutes left.
La prochaine question de Boris Proulx, Le Devoir. La parole est à vous.
Monsieur le ministre, 17 000 tests, il en manque 6 000 pour atteindre votre objectif. Qu'est-ce qui se passe avec ce trou de 6 000 tests? Est-ce qu'il y a des passagers qui rentrent sans se faire tester?
Il y a deux choses qui se passent. La première, c'est qu'il y a effectivement une capacité incomplète jusqu'à maintenant, même si elle a été augmentée significativement, comme on l'a noté au cours des derniers jours. La deuxième chose, c'est qu'il y a toujours une priorisation de ces allocations de tests aux frontières aériennes et terrestres. Donc, les gens qui arrivent de l'étranger sont testés d'une manière aléatoire, oui, mais d'une manière aléatoire qui tient compte des risques que ces gens puissent amener avec eux le virus ou le variant.
Merci. Est-ce que vous avez une idée du pourcentage de taux positifs qui reviennent ou combien de gens avaient effectivement la COVID-19?
Ça, je vais laisser la Dr. Tam et le Dr. Njoo vous donner ces informations parce qu'elles changent assez rapidement et ce sont eux là, qui ont les informations les plus précises.
Boris, est-ce que c'est possible d'avoir la réponse dans la deuxième partie de la conférence de presse?
Oui.
OK, parfait. Operator, next question.
The next question is from Alex Ballingal from the Toronto Star. Please go ahead.
Hi, thanks very much. I just want to clarify, Minister Duclos, you said that you expect the transmission of Omicron inside Canada will change, or the community transmission will change, if I heard correctly. Can you just clarify what you mean? Are you guys expecting that despite these border measures and the testing capacity and all the things you're doing to try and prevent more cases from entering Canada, that community transmission of this variant will increase?
Well, the answer is yes. Community transmission it will increase, and and in fact, it's an important feature of the presentation you'll hear very soon from Dr. Tam and Dr. Njoo.
So just quickly as a follow-up then, so what is driving that? If we're focusing on the border, what do we need to do to try and prevent that increase? Are we doing enough? Why are we expecting it to increase?
Our border measures are probably the most effective of all measures around the world. You know, we can always do better, but we've done extremely well compared to many other countries. And the reason is that we have multiple layers. The first layer is the pre-arrival test. Now, every traveler entering into Canada by land or by air needs to have a pre-arrival test. Now, the government has been criticized for that for some time. No, we should not have a pre-arrival test, but that's an absolutely central feature of our border measures right now, and this was going to be maintained. The second layer is the arrival test. That has always been there, but we're in a partial randomized manner, and now what we're doing right now is to make it complete for an important portion of air traveling. Then we have quarantine obligations that we have had since the beginning of COVID-19. And these measures, not only have they been maintained in many contexts since the beginning of COVID-19, but they were absent in many other countries. And that's another reason for which we have been extremely good through limiting importations of the virus and now the variant compared to many other countries. This being said, as we mentioned earlier, these tests and these procedures are by definition imperfect. So although they delay very significantly the importation of the virus and the variant, they are not going to stop the variant and the virus from entering into Canada. And that's why community transmission, although quite limited now, is going to be a challenge when the variant becomes more prevalent. But on that, again, it will be useful to hear and to turn to Dr. Tam and Dr. Njoo.
We have a couple of minutes left. Operator, next question.
La prochaine question de Annie Guillemette, Cogeco Nouvelles 98.5 FM. La parole est à vous.
Oui, bonjour, Monsieur le ministre. Vous avez parlé à quelques reprises des voyages. J'aimerais vous entendre en français, justement, sur la recommandation officielle. Vous avez dit à Louis Blouin, bon, ça change rapidement, il faut que les voyageurs soient conscients de ça. On en est où dans la recommandation officielle du gouvernement?
Bien, ce qu'on dit aux gens, c'est qu'au Canada, pour l'instant, il y a très peu de transmission du variant Omicron. À l'échelle internationale, dans beaucoup des pays où les gens peuvent songer à aller, la situation change très rapidement. Et le risque est double. Le premier, c'est que ces gens qui se retrouvent à l'étranger se retrouvent dans des circonstances très difficiles, puisque les mesures des autres pays peuvent changer très rapidement. Et on l'a vu au début de la COVID-19, il y a de cela 20 mois. Et la deuxième chose, c'est que lorsque les gens vont revenir au pays, bien, ils doivent s'attendre à ce que les procédures à la frontière et post-frontière sont des procédures qui prennent du temps, qui soient compliquées, qui les amènent à devoir se mettre en quarantaine pour un certain nombre de jours, qui pourraient très bien être plusieurs jours, parce que le système va être va être sévère et sérieux. On va devoir faire les choses correctement pour protéger la santé des gens. Donc, se soucier de ce double risque, celui d'aller à l'étranger, en fonction des endroits où les gens veulent aller, et celui de revenir au pays et d'avoir à vivre des désagréments et des délais qui vont déranger.
Je comprends donc qu'il n'y a pas de recommandation de ne pas voyager à l'heure actuelle. Ma question de suivi serait sur les tests rapides, les livraisons. Est-ce que encore là, on doit se fier aux compagnies, aux fabricants, parce qu'on n'a pas d'avance de livraison concernant les demandes qui ont été faites par les provinces?
Alors, les demandes et les livraisons vont très bien. Alors déjà, je parlais à mon collègue, le ministre Dubé, plus spécifiquement pour le Québec. Donc, la demande de 10 millions de tests rapides que le gouvernement du Québec a faite, elle est reçue, puis elle va être respectée d'ici la période des fêtes. Donc, le 10 millions de tests que le Québec a demandé. D'ailleurs, les tests dont on entend parler du gouvernement du Québec au cours des derniers jours, entre autres ceux qui vont être livrés dans les services de garde, ce sont des tests rapides qui viennent du gouvernement canadien, qui ont été livrés dans les derniers jours, que le gouvernement du Québec va utiliser, entre autres, dans les services de garde pour les jeunes enfants et les jeunes familles. Et les autres tests qui vont être livrés au cours des prochains jours pour atteindre le seuil et la demande de 10 millions de dollars, bien, ce sont des tests que le gouvernement du Québec va utiliser comme il le voudra bien. Et c'est la même chose pour les autres provinces et les autres territoires. Et je rappelle encore que ces 35 millions de tests qu'on est en train de livrer, c'est 5 fois la livraison moyenne des derniers mois. Donc, en travaillant ensemble très bien, et d'ailleurs, je félicite et remercie tous mes collègues des provinces et des territoires de l'avoir fait au cours des dernières semaines, en travaillant ensemble très bien, on est capable d'augmenter de manière très importante la quantité de tests qui vont être disponibles pour les familles et les gens au Québec et ailleurs.
Merci, Minister Duclos. The minister has to bid adieu to us because he has his plane. So hold on, and we will be turning to Drs. Tam and Njoo. Yes.
Okay, hello, everyone. Bonjour à toutes et à tous. Today, we'll provide a latest update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. As we head into the holiday season, we are faced with some new challenges, both in terms of renewed epidemic growth of the Delta-driven wave in Canada and the emergence and rapid spread of the Omicron variant of concern globally. At the same time, we've made important advancements by increasing our protection with vaccines and strengthening the measures we have available to reduce spread. Although uncertainties remain regarding the potential impact of Omicron, we know that maintaining these measures continues to be essential to the pandemic response in Canada, heeding public health advice, completing our primary series of COVID-19 vaccines, getting a booster shot when eligible, and keeping up with the basic personal precautions like wearing a well-fitted, well-constructed face mask, avoid crowding, improve ventilation, and other layers of protection continue to be our best and safest way forward.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologie et de modélisation effectués au pays qui orientent la gestion continue de la COVID-19 au Canada. À l'approche de la saison des fêtes, nous faisons face à de nouveaux défis, à savoir une nouvelle croissance de la vague provoquée par le variant Delta au Canada, ainsi que l'émergence et la propagation rapide du variant préoccupant Omicron dans le monde. Cela dit, nous avons réalisé des progrès importants en augmentant la protection conférée par les vaccins et en renforçant les mesures à notre disposition pour réduire la propagation. Bien que des questions demeurent quant à l'impact possible du variant Omicron, nous savons que le maintien de ces mesures reste essentiel pour la lutte contre la pandémie au Canada. Le respect des conseils de santé publique, l'obtention de la série primaire du vaccin contre le COVID-19 obtenir une dose de rappel pour les personnes admissibles et le maintien des mesures de précaution personnelles de base, comme porter un masque bien conçu et bien ajusté, éviter les foules, améliorer la ventilation et adopter d'autres moyens de protection continuent d'être la façon la plus efficace et la plus sûre d'aller de l'avant.
On slide 1, since the last epidemiology and modeling update in November, the trend in average daily case counts has shifted from a decline to a gradual but steady increase. Over the past week, there were an average of over 3,300 new cases being reported daily across Canada. With daily new cases increasing, there is concern that national severity trends could begin to rise again. On average, in the past week, over 1,460 people with COVID-19 were being treated in our hospitals each day, including over 450 in intensive care units, and 20 deaths were reported daily. As we head into the winter months with a strained health system in many areas of the country, a high degree of caution is needed to minimize spread and impact, particularly during the upcoming holiday season.
Diapositive 2. La situation vécue dans les 6 provinces les plus populeuses illustre les variations constantes quant à l'activité de la maladie pendant la 4e vague au Canada. Bien que l'activité de la maladie ait diminué dans de nombreuses régions durement touchées par la 4e vague, les données tardives sur les hospitalisations, les admissions aux soins intensifs continuent d'indiquer que le nombre de cas est élevé et que le système de santé est poussé à sa limite. Ne sont pas représentées d'autres régions du pays où la propagation de la maladie a été mieux maîtrisée au cours des précédentes vagues de la pandémie, mais où des introductions répétées du variant Delta qui se propage rapidement ont entraîné des éclosions ainsi qu'une transmission communautaire qui demeure difficile à contrôler.
Slide 3, our RT, the reproduction number, has been relatively unstable due to considerable regional variations in disease activity and day-to-day reporting fluctuations. However, nationally, the RT has remained above 1 for over 5 weeks, indicating that the epidemic is in a growth pattern.
Diapositive 4. Au cours des 3e et 4e vagues de la pandémie, le taux d'incidence a augmenté chez les enfants de moins de 12 ans, dont la majorité n'était pas admissible à la vaccination contre la COVID-19 avant l'autorisation récente d'un vaccin pour la tranche d'âge de 5 à 11 ans. Les programmes de vaccination des enfants constituent un nouveau moyen de protection important qui permettra de réduire les taux d'infection élevés dans cette tranche d'âge. En plus de conférer une protection directe aux jeunes enfants contre les maladies symptomatiques et potentiellement graves, la vaccination peut aider à réduire la propagation de coronavirus dans les écoles et d'autres milieux. Maintenant que 95% de la population est admissible à la vaccination, il y a d'autres avantages indirects à continuer d'accroître la couverture vaccinale dans la population, à savoir la réduction du fardeau du système de santé et la réduction de la propagation au sein des familles et des collectivités pour mieux protéger les enfants de moins de 5 ans qui sont trop jeunes pour être vaccinés. En particulier, il continue d'être important pour les parents et le contact proche des enfants de moins de 5 ans de recevoir une série complète de vaccins ainsi qu'une dose de rappel telle que recommandée qui contribuera davantage à leur protection.
Slide 5. This graph of cases associated with school and childcare outbreaks in Ontario and Quebec represents about half of the Canadian population, shows 5 to 11-year-olds remain the most prominent age group in these settings. However, encouragingly, several key features of the outbreaks involving children indicate sensitive monitoring and a positive impact of vaccination and infection prevention control measures that are being employed to keep these settings safer, while striving to keep them open for the benefit of children. Ongoing monitoring during the 4th wave indicates most school and childcare outbreaks involving youth have been small, with fewer than 5 cases. Compared to the 3rd wave, There were fewer school outbreaks associated cases occurring in the 12 to 17-year age group, which are increasingly well vaccinated. Outbreak activity in schools mirrors community trends, and vaccination of household members can help prevent spread to young children and subsequent introduction into schools. COVID-19 cases among children most often do not involve severe illness. To date, there have been over 380,000 reported cases in children and youth up to 19 years of age, with less than 1% involving severe illness.
Diapositive 6. Malgré que la circulation généralisée du variant Delta, hautement contagieux, reste la principale préoccupation au Canada et dans de nombreux pays, l'émergence de la propagation récente du variant préoccupant Omicron nous rappelle à quel point les choses peuvent changer rapidement dans le contexte de la pandémie. En collaboration avec les autorités sanitaires et des experts du monde entier, nous surveillons de près les caractéristiques clés du variant Omicron, y compris sa transmissibilité, sa gravité et son impact sur l'immunité. À date, il semble que le variant Omicron ait le potentiel de se propager beaucoup plus rapidement que le hautement transmissible variant Delta. À ce point, on ne sait pas s'il existe un risque plus élevé ou plus faible de maladies graves et de décès avec ce nouveau variant, mais il est possible qu'un plus grand nombre total de cas ait un impact sur la capacité du système de santé. De même, l'efficacité du vaccin est sous évaluation. Le variant Omicron pourrait diminuer la protection vaccinale contre l'infection, mais un certain niveau de protection contre la maladie grave est susceptible de rester. De plus, le variant Omicron pourrait échapper à l'immunité acquise par une infection antécédente. Peu importe le variant en circulation, la vaccination, combinée aux mesures de santé publique et aux précautions individuelles, continue d'être important pour ralentir les taux d'infection de la COVID-19 et aide à réduire l'impact sur le système de santé.
Slide 7. The Delta variant continues to circulate widely and is still associated with the vast majority of new infections reported in Canada. However, incidence varies considerably across health regions. Health regions that have achieved high vaccination coverage while maintaining public health measures continue to be in a stronger position for this winter respiratory season. And with the recent emergence and spread of the Omicron variant, including detections in most jurisdictions across Canada, we need to maintain a high degree of caution everywhere. As of December the 9th, there have been 87 confirmed cases of Omicron reported in 7 jurisdictions. Although most of the initial cases were detected in recent international travelers or their close contacts, cases with no known links to travel have been reported more recently, which may be indicative of community transmission. Fortunately, to date, all reported cases of Omicron in Canada have been asymptomatic or mild. Public health authorities and laboratories continue to closely monitor for additional cases in Canada and to assess symptoms and potential severity.
Diapositive 8. La récente approbation de vaccins à usage pédiatrique contre la COVID-19 pour les enfants de 5 à 11 ans au Canada signifie que 95% de la population canadienne totale est désormais admissible à la vaccination. Étant donné que certains enfants de 11 ans dont le 12e anniversaire est en 2021 ont reçu le vaccin de manière non conforme à l'étiquette dans le cadre du programme pour les 12 à 17 ans, le groupe âgé de 5 à 11 ans a déjà atteint 17% de couverture vaccinale, dont moins une dose, et 1% d'entre eux sont entièrement vaccinés. Dans l'ensemble, plus de 62,5 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada depuis le début de la vaccination à la mi-décembre 2020. Plus de 81% de la population totale a reçu au moins une dose de vaccin contre la COVID-19 et plus de 76% des Canadiens sont entièrement vaccinés. De plus, au-delà de 2 millions de troisième doses de vaccin contre la COVID-19 ont été administrées. De même, la couverture vaccinale a continué à augmenter dans tous les groupes d'âge, atteignant plus de 88 à 95 couverture vaccinale complète parmi les adultes de 50 ans et plus et de 82 à 86 couverture vaccinale complète parmi les jeunes et les adultes de 12 à 49 ans. Cependant, si l'on tient compte des enfants de 5 à 11 ans, plus de 7 millions de Canadiens sont admissibles à la vaccination, mais ne sont pas encore entièrement vaccinés contre la COVID-19. Il est donc important que nous poursuivons nos efforts pour augmenter la couverture vaccinale afin de protéger autant de personnes que possible.
Slide 9. Being fully vaccinated continues to provide substantial protection from severe illness, in particular younger people who are at lower overall risk of severe illness due to COVID-19 and develop stronger, longer-lasting immunity from vaccines than older adults have a substantially lower risk of hospitalization if they are fully vaccinated compared to being unvaccinated. Among youth and adults aged 12 to 59 years, unvaccinated people were 32 times more likely to be hospitalized with COVID-19 than fully vaccinated people. And even though older adults have relatively higher overall risk of developing severe illness and may have less robust response to vaccinations, being fully vaccinated still provides a clear and significant protection advantage against severe illness compared to not being vaccinated. Among adults aged 60 years or older, unvaccinated people were 16 times more likely to be hospitalized with COVID-19 than fully vaccinated people. As health authorities across Canada continues to monitor vaccine safety and effectiveness data, advice and programs are being regularly updated to ensure Canadians are provided and can maintain the best possible protection against COVID-19.
Diapositive 10. Cette mise à jour des prévisions à plus long terme montre comment la trajectoire épidémique pourrait évoluer jusqu'à la mi-janvier, y compris la trajectoire potentielle avec et sans remplacement de Delta par Omicron. Si nous continuons sur la voie que nous suivons actuellement, avec nos niveaux de transmission actuels, mais sans que le variant Omicron remplace le Delta, nous pourrions nous attendre à voir une résurgence des cas le long de la trajectoire de la ligne gris foncé. Si Omicron ne prédomine pas sur Delta, nous pourrions mieux contrôler l'épidémie le long de la trajectoire de la ligne violette en diminuant de 15 la transmission à l'échelle de la communauté. Or, alternativement, même si Delta continue de prédominer, une augmentation de 15 de la transmission pourrait entraîner une résurgence rapide des cas le long de la trajectoire de la ligne bleue. Cependant, si on suppose que le variant Omicron est 3 fois plus transmissible que le variant Delta et qu'il devienne prédominant au Canada, il est possible que nous ayons une résurgence de cas le long de la trajectoire de la ligne orange qui s'accélère rapidement. Bien qu'il existe encore une incertitude considérable concernant le potentiel d'Omicron à échapper à l'immunité et à augmenter la gravité, une résurgence rapide des cas pourrait potentiellement mettre à rude épreuve notre système de santé bien fragile. Bien que cette provision soit préoccupante, il nous est rappelé que les modèles ne montrent que les possibilités futures et qu'avec une action rapide et appropriée, nous pouvons éviter une trajectoire selon le scénario de pire cas possible, comme nous l'avons fait dans le passé. La vitesse de transmission d'Omicron et le potentiel pour une forte résurgence signifient que nous devons aborder les semaines à venir avec beaucoup de prudence et en même temps être prêts à agir rapidement pour contrôler la propagation au premier signe d'une accélération rapide des cas. Je veux aussi attirer votre attention à la diapositive 17 qui démontre qu'une résurgence est actuellement prévue pour l'Ontario et le Québec. Si le variant Omicron remplace Delta, la résurgence serait possible dans d'autres régions.
Thank you. Just to repeat what Dr. Njoo just said, there is a slide 17 in your package that shows some of the regional forecasts indicating that resurgence is forecasted in a number of regions if Omicron replaces Delta. So these scenarios on slide 11, these scenarios do not include the potential impacts on the Omicron. But aims to illustrate what could happen through 2022, taking into account the possibility of waning protection of vaccines. It is important to note that this model assumes a very significant waning of protection in order to better illustrate the potential impact of different vaccination strategies. The scenario on the left illustrates an extreme example to show what could happen if there was no vaccination of 5 to 11-year-olds and no boosters given to adults. In this scenario, the model shows there is a high risk of having a resurgence with the potential to exceed hospital capacity in 2022. In the middle scenario, which includes vaccinating 5 to 11-year-olds, but with still no boosters given to adults, the simulated scenario is improved, but resurgence could still occur. Lastly, in the scenario on the right, the combined effect of vaccinating 5 to 11-year-olds and giving booster doses to adults 18 years of age or older could significantly reduce the risk of resurgence in 2022 under the assumptions in the model. This scenario could therefore reduce the risk of exceeding hospital capacity in the months ahead. While these are just theoretical scenarios, this modeling highlights the importance of expanding and strengthening our vaccination programs to reduce the risk of strong resurgence.
Diapositive 12. Les expériences au sein d'autres pays continuent de renforcer le besoin pour une couverture très élevée de la vaccination avec l'application soutenue des mesures de santé publique et individuelles afin d'éviter une résurgence rapide prédominée par le variant Delta, ainsi que de retarder l'accélération et le remplacement par le variant Omicron à propagation encore plus rapide. Comme pour d'autres pays d'Europe, la trajectoire de l'Allemagne illustre qu'en dépit des succès antérieurs à maîtriser l'accélération de l'épidémie, l'assouplissement des mesures de santé publique en l'absence d'une couverture vaccinale très élevée peut entraîner une forte résurgence d'une vague Delta, mettant à rude épreuve la capacité des soins de santé. Alors que le variant Omicron commence à se propager là où le variant Delta est encore prédominant, des pays comme le Royaume-Uni illustrent la vitesse à laquelle Omicron peut s'installer des premières détections à l'expansion rapide de la propagation communautaire. Cela nous met en garde contre la forte probabilité qu'Omicron remplace le variant Delta dans un laps de temps très court. Ceci est clairement illustré par le pic presque vertical observé dans les cas en Afrique du Sud, car Omicron a rapidement accéléré et remplacé le variant Delta. À l'échelle mondiale, le variant Omicron se répand de plus en plus rapidement. La transmission communautaire est maintenant signalée dans de nombreuses régions du monde, y compris de nombreuses régions des États-Unis. À la lumière de cela, les Canadiens sont priés d'examiner attentivement les risques accrus et le potentiel élevé des perturbations associées aux voyages internationaux pendant les périodes des fêtes.
Slide 13. Despite the challenges ahead with the continuing Delta-driven wave in Canada and emergence of the Omicron variant, we have more and better protections going into this holiday and winter season than previously. This time last year, we were experiencing double the number of daily cases and more than double the number of people with COVID-19 being treated in hospitals and in intensive care daily. Most importantly, daily reported deaths are 82% lower than this time last year. Vaccines have given us substantial protection from infection and severe outcomes to date, dampening the impact of the Delta-driven wave this fall, which could have been many times more severe or required more stringent restrictions had it not been for the added protection of vaccines. Vaccines in our expanding coverage continue to give us an advantage over this virus, And while some reduction in protection is possible with the Omicron variant, COVID-19 vaccines are still expected to provide a level of protection, particularly against severe outcomes. As well, experts and health authorities continue to update our vaccination program advice, and we can better ensure that Canada's vaccines and vaccination programs continue to provide Canadians with the best possible protection. So, as we look to the holidays and weeks ahead, caution is still warranted. But as you consider the risk for you and yours, we can be thankful we're better protected with vaccines and have more choices to allow us to come together more safely. We're safer when everyone who is eligible is fully vaccinated, and if all who are eligible also get a COVID-19 booster dose. And regardless of our vaccination status, we can stay safer over the holidays by keeping up with the latest public health advice, taking precautions when in indoor spaces with others outside our immediate household, and using layers of protection to reduce risks, including wearing a well-constructed and well-fitted face mask, keeping gathering sizes smaller, and improving ventilation. Maintaining our good habits with hand and cough hygiene, staying home and away from others if we're experiencing any symptoms, and getting a COVID test, especially if symptomatic or as recommended. The speed of Omicron transmission and potential for strong resurgence means we must approach the holidays and weeks beyond with an abundance of caution, while being prepared and following the advice of health authorities who will need to act quickly to control spread at the first sign of rapidly accelerating cases. Thank you. Merci, Miigwech.
Et finalement, pour terminer, la diapositive 13. Malgré les défis à venir avec la vague continue entraînée par le variant Delta au Canada et l'émergence du variant Omicron, nous avons des protections plus nombreuses et plus efficaces pour cette saison des vacances et de l'hiver qu'auparavant. À la même époque, l'année dernière, nous connaissons le double de nombre de cas quotidiens et plus de double de nombre de personnes atteintes de la COVID-19 étaient traitées quotidiennement dans les hôpitaux et les soins intensifs. Plus important encore, les décès signalés quotidiennement sont 82% moins élevés qu'à la même période l'an dernier. Les vaccins nous ont offert une protection considérable contre l'infection et les conséquences graves et atténuant l'impact de la vague provoquée par Delta cet automne, qui aurait pu être beaucoup plus grave ou nécessiter des restrictions plus strictes sans la protection supplémentaire des vaccins. Les vaccins et l'expansion de notre couverture vaccinale continuent de nous donner un avantage envers ce virus, et bien qu'une certaine réduction de la protection soit possible en vue du variant Omicron, les vaccins contre la COVID-19 devraient toujours fournir un niveau de protection, en particulier contre les conséquences graves. De plus, alors que les experts et les autorités sanitaires continuent de mettre à jour nos conseils sur les programmes de vaccination, nous pouvons être mieux assurés que les vaccins et les programmes de vaccination au Canada continuent de fournir aux Canadiens la meilleure protection possible. Donc, alors que nous nous tournons vers le temps des fêtes et les semaines à venir, la prudence est toujours de mise. Mais si vous considérez les risques pour vous et les vôtres, nous pouvons être reconnaissants d'être mieux protégés par les vaccins et d'avoir plus de choix pour nous permettre de se rassembler en sécurité. Nous sommes plus en sécurité lorsque toutes les personnes éligibles sont entièrement vaccinées et si toutes les personnes admissibles reçoivent également une dose de rappel contre la COVID-19. Et, quel que soit notre statut vaccinal, nous pouvons rester plus en sécurité pendant le temps des fêtes en suivant les derniers conseils de santé publique, en prenant des précautions lorsque nous nous trouvons dans les espaces intérieurs avec des personnes en dehors de notre foyer immédiat et en utilisant des niveaux de protection pour réduire les risques, comprenant porter un masque facial bien construit et bien ajusté, garder nos rassemblements plus petits et améliorer la ventilation, maintenir nos bonnes habitudes d'hygiène des mains et de la toux, rester à la maison et loin des autres si nous éprouvons des symptômes et se faire tester pour la COVID-19, particulièrement si vous avez des symptômes ou tels que recommandés. La vitesse de transmission du variant Omicron et le potentiel d'une forte résurgence signifie que nous devons aborder le temps des fêtes et les semaines au-delà avec beaucoup de prudence, tout en étant préparés et en suivant les conseils des autorités sanitaires qui devront agir rapidement pour contrôler la propagation au premier signe de cas qui s'accélère rapidement. Merci. Thank you. Miigwech.
Thank you. It's time for questions. We will start with questions in the room. Those who want to ask a question, go to the mic, and then we will go to questions on the phone. It's one question, one follow-up. First question to Mike LeCouture, Global.
Doctors, thank you for taking the time to take our questions. In light of the modeling you've just presented and the warning of prudence, there are a number of Canadians who have followed a lot of these briefings and who've done everything you've said, got double vaxxed, and with the promise of, if you get double vaxxed, you'll be able to do more things. And we know things have changed. But what is your message to Canadians who have this feeling of invincibility because they did get double vaxxed and feel like, I should be able to gather, I should be able to travel? With everything that you're presenting right now, what is your clear message to them about making decisions in the next 2 weeks to either have a gathering at home or travel?
This is Theresa Tam. Maybe I'll start. So getting the vaccine is still the most important layer of protection, and people should still get it if you haven't, and get a booster shot, particularly people over the age of 50. And that is still key advice. Because what we are seeing is that vaccines are still very good at protecting you against severe outcomes. So that's really important to do. In terms of the time period ahead and going into the holiday period, it is actually, of course, really difficult for people to think, well, we've done all these things. We're really looking forward to a giant party. And now you're telling us that there's another variant. I've been saying that the winter period is going to be a bumpy road towards a brighter spring, if you like. So this is another bump on the road, and we still don't know enough about the Omicron variant, except that it looks like it's very transmissible. So I think that keeping private gatherings small is actually quite important at this point while we learn more. I think that you can still have a really good time by linking with family or your immediate friends, and so that you can do this safer. Gathering with smaller number of people in well-ventilated places, all of those layers of protection we just talked about can still enable you to have a good time while being safer and being precautionary. Of course, gathering with vaccinated people is still going to be safer than gathering with unvaccinated people. But if you've seen some of the news about this Omicron variant, is that vaccinated people could still get infected. So you just need to be mindful of that. In terms of travel, I think that traveling within Canada at this point in time means that you're likely to have a much better experience than if you're heading into the international destinations. So I think if you haven't actually booked any of these trips, staying closer to home, I think is definitely the better choice. And if you have already booked your trips, as the minister said, things can change very rapidly in the international context. Right now, and every hour, there's a different number, but what I do know is 61 countries, as of last night at least, have already confirmed that they have the Omicron variant, and some of them haven't detected widespread community transmission. But still, because of that uncertainty, people need to take it into account, not just because of your risk of getting infected, but a risk of all the different rules that might be fluctuating in the international context.
Thank you for
it's
that.
Dr. Njoo. I just underline that the main points that Dr. Tam has already put forward. If you look at this sort of holiday season compared to last holiday season, I think it really, I think it's a bit different, obviously, because we have the vaccines and they're a great tool. So I think to underline the point again, try to ensure as much as possible that if you have any family gatherings, that everyone's vaccinated, and if obviously if you're eligible, get that sort of a booster dose. So that's number one. And of course, now the kids 5 to 11 are also eligible to get a vaccine. So that's great. But all the other proven public health measures that we've been repeating so often about, face masks and so on, I think we need to double down on that. I think people, you're right, maybe have been, I guess, reassured because of the vaccines and how well they've worked that, oh, okay, maybe I don't need my face mask. But, there's emerging evidence that, with the new variants, they're so much more transmissible, and even people who are fully vaccinated can still, get infected and pass it on. So if you have a family gathering, as Dr. Tam said, maybe try and keep it small. Maybe there's a good discussion to be had about people, even fully vaccinated, still wearing their face masks indoors, obviously well fitted, well made, and so on. And then the other part about ventilation, we talked about it, previously, but it's maybe something to consider this holiday season. I know it's the winter, but maybe, having a window open maybe for a certain amount of time, on the hour, et cetera, it just can help, the circulation of the, the virus sort of dissipate. So those are sort of practical things you can do. And then, of course, all the other things, but good hand hygiene, of course, don't even think of hopefully, getting together with people if you're sick and staying home. I think all that applies. For international travel, it's the same thing. Take a serious look at, your vaccine status. If you are maybe in a certain age group that has underlying, health issues, other conditions that put you at higher risk of severe consequences, I think you should really think twice, even if you're fully vaccinated. Then, of course, as Dr. Tam said, looking around the world, it's the pandemic's raging in many countries around the world that haven't been so fortunate as ourselves in terms of their vaccine coverage and sort of the use of public health measures. And so it really, I think, behooves you to take a careful look. What is the vaccine coverage? What is the epidemiology if you're still planning to go overseas and take a careful look? And as we all know, the situation can change rapidly. If, let's say, there's widespread community transmission suddenly occurring in a country that you might be wanting to go to, then the local authorities might put in measures that maybe aren't in place now. And of course, coming back to Canada, certainly we're trying to do what we can to slow the spread of the vaccine in Canada with what we're doing at our border with testing and quarantine. So those are all the things to think about, and hopefully Canadians can take that to heart and plan accordingly. Thank you.
Thank you for those fulsome answers. I just wanted to sort of pick up on the sentiment out there in Canadians and how, despite being fully vaccinated now, where you guys are looking at Omicron right now and the potential of having to bring back in or at least suggest lockdowns or different other restrictions, how worried are you about how those could be received when you consider the fatigue that is being experienced by Canadians who feel invincible being fully vaxxed, because that's exactly what you said Canadians should do? And how are you weighing that as you look at the curves and how you're trying to stop Omicron from taking hold here in Canada?
It's Theresa Tam. I'll take that. So I think people should take heart in that, as you've seen, even if you go back to one of the first slides, slide 2 or something like that, on the different curves, what is most striking is the reduction in deaths and some of the severe outcomes. So I think people should bear that in mind. This is a gift that we did not have last year. And I think focusing on and how much that has given us. It is tough, and this virus keeps dealing us the next card in the deck. And sometimes, it is difficult to imagine, but we can get through this. I am still optimistic. This is another bump. I think we should, I certainly feel better about not getting severe outcomes from definitely the Delta virus. We still have to learn more about the Omicron virus in terms of severity. But I think why we're asking for caution is that when that curve takes off, and it can take off very rapidly, as you've seen in the United Kingdom, even lower severity impacts can result in a large number of people ending up in the hospital. So we just want to keep things smoothed out and manageable. And so I think we're asking for everyone to collaborate so that you don't have to close schools and do all those things. This year is very different. Look at this fall compared to last. We've had the ability to ensure people are back in those essential work, school, and economic spaces. Let's try and keep it that way.
Bonjour, une question pour le Dr Njoo. Première question en deux volets. J'aimerais savoir, à vos yeux, selon vos estimations, quelles sont les probabilités que le variant Omicron devienne dominant au Canada? Parce qu'on a l'impression, à vous écouter, que c'est un peu inévitable. Et j'aimerais savoir à quoi ressemblerait la vie si le variant Omicron devenait dominant? Est-ce qu'il faudrait s'attendre à plus de restrictions? À quoi ressembleraient les mesures sanitaires qu'il faudrait prendre, d'après vous?
Merci pour la question. Oui, c'est une bonne question. Et à l'heure actuelle, on continue avec nos homologues à travers le monde à ramasser les données probantes pour répondre aux trois questions importantes pour le variant préoccupant. Transmissibilité, aussi gravité de la maladie, aussi l'efficacité des vaccins. On a des indications, peut-être c'est plus transmissible, même comparé à le variant Delta. Donc, ça c'est une chose. Mais pour les deux autres questions, on ne sait pas encore. Ça, c'est quelque chose encore à suivre étroitement avec la situation ici au Canada et aussi à travers le monde. Ce qu'on voit dans les pays, même maintenant en Europe, c'est possible que le variant Omicron peut être le variant prédominant dans peut-être un bout de temps, quelques semaines. On voit qu'est-ce qui se passe actuellement en le Royaume-Uni, aussi en Allemagne, les autres pays. Donc, c'est quelque chose on peut imaginer, c'est possible ici au Canada. C'est pourquoi nous continuons avec nos meilleurs efforts à la frontière, mais aussi, je pense, au sein du pays pour suivre, contrôler la propagation, ralentir la propagation le plus possible. Jusqu'à date, on voit avec les cas signalés à date ici au Canada que les cas sont asymptomatiques ou même avec les symptômes légers. Donc, ça, c'est des bonnes nouvelles, mais il ne faut pas être, comme on dit, trop optimiste. Il faut toujours être prudent et continuer à utiliser toutes les mesures de santé publique et aussi l'adoption des vaccins pour ralentir la propagation. Mais c'est toujours possible et on ne peut pas dire non. Ce n'est pas le cas au futur que le variant Omicron peut être prédominant. Donc, il faut continuer avec l'adoption des vaccins et continuer avec les mesures de santé publique.
Vous dites qu'on assiste à une resurgence en Ontario, au Québec, deux provinces qui ont augmenté le nombre de personnes autorisées pour un rassemblement de Noël. Est-ce que c'est une approche qui est souhaitable quand vous voyez cette resurgence-là, d'après vous? Et vous avez parlé de réduire la taille des rassemblements de Noël. Alors pour vous, c'est quoi un rassemblement de Noël qui serait raisonnable?
Ça, c'est difficile à répondre parce que oui, on a toujours, comme il dit, un avis personnel. Ce que je peux vous dire, c'est que dans les provinces de l'Ontario et le Québec, on est toujours, comme il dit, en bonne communication et étroite collaboration avec nos homologues. Et c'est sûr que les autorités de santé publique dans les deux provinces, mais en effet, à travers le pays, suivent étroitement la situation épidémiologique dans leur propre juridiction. Et c'est sûr que ils sont prêts à peut-être à changer, adopter, peut-être à modifier les mesures de santé publique. Concernant les rassemblements, je ne sais pas, peut-être c'est même quelque chose que les provinces peuvent peut-être ajuster dans les jours, semaines à venir. Mais pour moi, personnellement, je pense que ce n'est pas une bonne idée de voir peut-être un rassemblement de 25 personnes, 20 personnes, peut-être quelque chose de plus intime. Je vous laisse imaginer c'est quoi plus intime pour moi. Peut-être un rassemblement pour moi personnellement en famille, peut-être 10 personnes ou quelque chose comme ça, mais c'est vraiment quelque chose pour pas vraiment seulement à l'échelle de la province, mais aussi en considération c'est quoi la situation épidémiologique régionale dans une région, dans une ville. Donc, c'est très important de suivre les conseils des autorités sanitaires à l'échelle locale. Moi, j'ai un avis personnellement pour moi comme une autre évaluation pour rassemblement pour ma famille, mais c'est sûr, je vais suivre aussi les consignes et qu'est-ce que les autorités à l'échelle locale vont me dire. Merci.
Thank you. Kristen Agakute, sorry for that, CTV.
Thanks, doctors, for taking our questions. On slide 11, it shows that if vaccinations are offered for kids 5 to 11 and boosters are offered to 18 plus, cases will not exceed hospital capacity. Why is NACI not giving a strong recommendation that all 18 plus be eligible for boosters right now?
I think NACI has recommended that boosters be offered to 18 plus, but the focus, and if your objective is to reduce serious outcomes, the key focus still remains the older age groups and the other higher risk populations. So I think for systematic rollout, but also because there's a recommendation at this point to maximize the immune response and using a interval of 6 months or more, which means that if you do a systematic rollout from when you had your last dose, it actually just works out logistically and programmatic planning perspective that the younger age groups will come a bit later. So I know that all province territories are focused on getting the older age groups and the higher risk groups vaccinated right now. That's just the priority. But I think all of them are committed to essentially moving towards everybody getting their booster. Of course, with the Omicron variant, we are still awaiting some of the further information on its impact on vaccines.
And my second question, Dr. Tam, you mentioned there is now community spread of the Omicron variant, so travel restrictions will likely not be enough to stop this spread. Will you recommend that provinces start putting in place more restrictions and gatherings to stop this community spread?
We have reports, and they're not many. There's the odd report of people with Omicron who cannot be linked to a travel-related case. So that is a first sign of community spread. We haven't seen a major spread, or at least we haven't had it reported to date. So it depends on where you are, as it has been throughout the pandemic. The epidemiology can be quite different in different provinces, territories. So the local epidemiology absolutely will drive the response. And if you're seeing a rapid increase in cases, or there's a cluster of Omicron, then, as previously, my suggestion is act fast so that you can come out of it quicker. By acting fast now and making sure people are observing all these layers of protection, and keep your gathering sizes small, while we're still learning about this Omicron variant, is the most prudent thing to do. But it depends on where you are in the country.
Thank you. Ashley Burke, CBC.
Hi, Dr. Tam. What's it like for you to hear that there are claims that staff are neglecting those staying at designated quarantine facilities? Complaints about a lack of food, lack of answers about what's going on, lack of medical help. Is that acceptable to you?
I think one must strive to be as as effective as possible, as supportive as possible for people who have to undertake quarantine, which is a difficult thing to do. So while I'm not directly involved in the operational aspects of the quarantine service, I do think that any of these incidences must be reported so that they can be prevented going forward. So, I think everything has to be done to support those who are in quarantine.
And do you believe that in light of what you presented today, that boosters need to happen immediately, not 6 months after you get a vaccine?
Well, I think we're still learning about the impact of the Omicron virus on vaccines. It's possible that, and quite likely that when you get a booster, your antibody levels, for example, one part of your immune response could get boosted. And there's some very early laboratory studies, including from manufacturers, that certainly suggest that a booster dose can increase that response. But some of the studies doesn't really indicate what happens to the rest of the immune system, and the vaccine effectiveness has not been determined. I think that, of course, we can shift recommendations, but right now, we know based on vaccinology and decades of knowledge on vaccines that if you want the best or optimize your schedule, then the intervals matter. So NACI's recommendation for that interval could then increase the quality and the duration of your immune response. So I think, of course, we will be meeting, NACI can examine the issue further, and the provinces will too, once we get a bit more information from, mainly from the international experience. And there's a large amount of studies being undertaken in laboratories, in animal studies, and I hope from Europe on the real life experience of the vaccines. The other thing that I'm trying to keep in mind is that this is not the only variant that is necessarily going to come along. So we can't just keep thinking of 2 weeks ahead. We have to think about the slightly longer term, not just Christmas, but towards March break. So how do we ensure that we give the best advice on the vaccine so that the durability of that response is as good as we get. So I think the concern is that if we boosted, which I think can increase your vaccine, can increase your neutralizing antibody levels, for example, that might not last for very long. And so all of these things are being weighed. But all I can say is go get your booster when it's your turn, and please do that, and particularly those at high risk.
Thank you. Laura Osmond, Canadian Press.
Hi, Dr. Tam. You touched on this a little bit already, but on slide 10, rather, the possibilities you outlined there are quite intimidating. I'm wondering if you can speak a little bit about what you would project in terms of severe outcomes as those projections go way up. If Omicron were to take hold in Canada, what would you expect to see in terms of hospitalizations based on what we know right now?
Thank you. So what we don't know is the severity of illness from this particular variant. And we do not know the impact of vaccine effectiveness against severe outcomes. The earlier, very preliminary information coming out of South Africa and right now is that they've encountered more milder illness. And certainly the travelers that we've had coming into Canada with Omicron have had mild or asymptomatic illness. But we must not take that for granted right now. We need to wait and see because of the delay in seeing the severe outcomes from the initially infected cases. So that model doesn't model the severity. But even if the proportion of those who get Omicron who get severely ill is tiny, if you get enough cases, you'll still have enough severe outcomes to impact your hospitals and your ICUs. So I think that is the message. And so for now, while we're still learning about this virus, being precautionary will help protect your health system.
I think people just want to know exactly how concerned they should be, given that they're vaccinated, they're protected, they're following the basic public health rules. Omicron is like a big boogeyman at this point. Given what we know about the safety that we do have, how concerned are you for people's individual safety?
Well, I think we must stay informed and vigilant, but we shouldn't panic. We know many of the layers of protection that work for any variant. If it's a more transmissible variant, you do have to be more careful when you are putting on a mask. Make sure it fits. Get the best quality mask you can get your hands on. Improve on ventilation. So when there's a more transmissible virus, we've just got to pay even more meticulous attention to the things that we know already works. I think that's the key. We will learn more, and we will let you know, I think, as soon as possible when we do learn more about the impact of vaccines. But Delta is still 90-something% of our cases, and we know vaccines work for that variant. And so I think we stay on course for now, and we will obviously inform everyone when there's more information. I still think people should take heart in having personal agency. We know how to assess our own risk. We know how to assess the risk of a particular contact or gathering, and use all of that knowledge to our advantage, and just keep the transmission low so that it's not going vertical. When we keep it low, we can then learn more in the next weeks to come, and then we can take the next steps. But still, I think people should feel optimistic about the longer term outlook.
It's Dr. Njoo, maybe I can just add to what Dr. Tam has said, and I think to your question, I think if I were to characterize, I think we should all, including myself, respect the virus. It's a formidable foe, and it's obviously evolving as we, fight against it. And so we just need to, I think, respect it, but not to panic and be scared. We have a great number of tools now, and we know much more about the virus. So with vaccines as a great tool to help protect against serious illness, and then also with all of the proven measures, the face masks and so on, because we know about much more about how the virus is transmitted and so on. I think we just need to be respectful and cautious, but like I say, not to be, I say, in sort of the panic mode, which I get the sense from your question, maybe some people are worried about. So hopefully that helps answer and hopefully give a level of assurance to the general population that, hey, we've dealt with this before when we first, face this virus, and we can do it again with all of the tools that are at our disposal. Thank you.
Thank you. Time to go to the phones for questions. It'll be one question, one follow-up, and operator, if it's possible, to give precedence or preference to the members of the Parliamentary Press Gallery. Operator, first question.
Certainly. The next question is from Jimmy Morasha from Global News. Please go ahead.
You guys actually answered all my questions, so you can skip me.
That was fast. Operator, next question.
Thank you, merci. The next question is from Catherine Lévesque from la Presse canadienne. La parole est à vous.
Oui, bonjour à vous tous. Je voulais en fait vous poser une première question qui avait été posée à M. Duclos et on n'a pas eu une réponse. Donc, je voulais savoir, selon l'Agence de la santé publique, là, pour ce qui est des tests de dépistage aux aéroports pour tous les voyageurs, là, à l'exception de ceux en provenance des États-Unis, à quel moment est-ce qu'on va avoir l'assurance que tous les voyageurs vont être testés? Est-ce que vous avez une estimation? Est-ce que c'est une question de jour? Qu'est-ce que vous pouvez nous dire là-dessus?
C'est Dr. Njoo. Merci pour la question. Peut-être je peux commencer et peut-être aussi Dr. Tam peut ajouter. Comme Dr. Tam, je pense que déjà constaté, nous deux, nous ne sommes pas, comme elle dit, vraiment à l'échelle des aspects opérationnels. Je pense que ce que je peux vous dire maintenant, c'est qu'on sait c'est quoi l'objectif, le but avec les dépistages, toutes les mesures en vigueur à nos frontières. C'est vraiment, je pense que moi, j'ai dit ça avant avec un autre point de presse, que c'est vraiment pour peut-être gagner du temps, pour ralentir peut-être la propagation du virus comme le variant Omicron, pour gagner du temps, pour peut-être mieux comprendre, pour avoir le temps ici au Canada, mais aussi partout dans le monde pour ramasser, analyser les données probantes concernant les trois grandes questions, la transmissibilité, gravité de maladie et aussi l'efficacité des vaccins. Et donc, toutes les mesures comme une date ou combien de dépistage, c'est important, mais je pense que la plus grande question, c'est quoi les implications et l'impact. On voit maintenant, actuellement, on a déjà les cas signalés ici au Canada, donc c'est très important aussi, même au sein du pays, qu'est-ce qu'on fait pour contrôler, pour faire un bon suivi des contacts, pour aussi mieux comprendre c'est quoi les implications pour peut-être la transmission communautaire à l'échelle locale. Donc, je pense qu'on continue avec nos efforts. Comme le ministre a constaté, on continue à augmenter la capacité de dépister à la frontière, mais c'est fait partie d'un ensemble des mesures, je pense, de santé, de mesures de santé publique à la frontière, mais aussi au sein du Canada pour faire face, s'adresser aux variants.
Et merci beaucoup. Et je voulais revenir sur les rassemblements de Noël. Donc, vous avez dit il y a quelques minutes à mon collègue Louis Blouin que c'est pas une bonne idée d'avoir un rassemblement de 20, de 25 personnes. Vous n'êtes pas sans savoir que les cas sont toujours vraiment en augmentation au Québec, en Ontario, et c'est justement dans ces deux provinces-là qu'on prévoit, en fait, qu'on a le droit de se rassembler à 20 ou 25 personnes pour Noël. Je voulais savoir, est-ce que vous espérez que ces deux provinces-là reviennent un peu sur leurs décisions et décident de diminuer le nombre de limites de personnes à temps pour les fêtes?
OK. Merci pour la question. Ce que j'ai déjà constaté, c'est comme un avis personnel. Pour moi, je pense que je suis prêt à planifier pour un rassemblement en famille, comme on dit, plus intime avec moins de personnes. Mais c'est sûr, c'est très important de toujours suivre les consignes des autorités de santé publique à l'échelle locale. Donc, je pense que même pour les provinces de l'Ontario et du Québec, je pense que peut-être ils vont peut-être ajuster, modifier les limites de rassemblement à l'échelle de la province, mais je pense peut-être aussi une flexibilité pour ce que les autorités à l'échelle locale puissent faire aussi. Donc, je pense que tout le monde est prêt à avoir la flexibilité de peut-être changer, modifier. C'est pas pour moi, c'est vraiment une question d'analyser c'est quoi la situation épidémiologique à l'échelle locale et être prêt à modifier, adapter comme c'est nécessaire. Merci.
Operator, next question. Prochaine question.
Thank you, merci. La prochaine question est de Olivier Ferron-Boissé de TVA. La parole est à vous.
Oui, bonjour. J'aimerais revenir sur le graphique concernant la capacité hospitalière. Bon, si on a une troisième dose aux 18 ans et plus et aux 5 à 11 ans, on comprend qu'on ne la surpassera pas. J'aimerais vous entendre là-dessus dans le contexte où le CCNI recommandait d'élargir la troisième dose aux 50 ans et plus. Il y a des provinces qui l'ont fait, qui ont un plan pour y arriver, mais au Québec, on va élargir seulement aux 60 ans et plus, seulement au mois de janvier. Croyez-vous que la province devrait appuyer sur l'accélérateur?
Merci pour la question. C'est ce qu'on sait tout le monde. C'est toujours les questions. On ne sait pas les réponses concernant le variant Omicron. Pour les questions de gravité de maladie, aussi l'efficacité des vaccins. Mais on sait que les vaccins sont un de nos meilleurs outils à utiliser. Donc, je pense avec la modélisation, on voit que si on peut augmenter la couverture vaccinale, en incluant maintenant les enfants de 5 à 11 ans et aussi offrir une dose de rappel pour les populations prioritaires qui sont les plus à risque à avoir les conséquences graves, comme les personnes plus âgées, les personnes aussi immunodéprimées. Ça, c'est vraiment l'objectif. C'est difficile à répondre maintenant avec les données probantes qu'on a devant nous actuellement, mais je pense que c'est quelque chose qu'il faut, continuer à être prudent parce que, comme on a déjà constaté, si le variant Omicron devient le variant prédominant, et même si en général les conséquences ne sont pas graves pour une très grande partie de la population atteinte avec une infection, avec peut-être même un faible pourcentage avec les conséquences graves. Si le nombre actuel est plus grand et continue d'augmenter, c'est toujours possible d'avoir un risque accru pour avoir des conséquences pour nos systèmes de soins de santé. C'est pourquoi on dit que c'est très important d'augmenter la couverture vaccinale le plus haut possible avec les enfants aussi, les populations prioritaires. Je pense que chaque province continue avec leurs meilleurs efforts d'offrir les vaccins, aussi des doses de rappel. Et je pense que on va voir au fur et à mesure qu'est-ce qui se passe actuellement avec la propagation du variant Omicron, mais aussi, comme on a déjà constaté à plusieurs reprises, le variant Delta, parce que ça reste encore le variant prédominant au Canada.
Merci. Justement, sur Omicron, je comprends que s'il devient prédominant au Canada, dans certaines provinces, on va remarquer une hausse accrue des cas. Ça va augmenter parce qu'il n'y a pas nécessairement en ce moment de progression du Delta. Mais au Québec, en Ontario, c'est moins clair. J'ai de la misère à interpréter la courbe. Quel genre de situation on aurait de différente si ça devient prédominant Omicron par rapport à Delta? Est-ce que ça va être réellement des hausses de cas beaucoup plus prononcées comme on voit dans les autres provinces ou ça devrait rester similaire à ce qu'on projette pour Delta?
Merci pour la question. Moi, je ne suis pas un expert de modélisation. Oui, il y a toutes sortes de questions que nos experts continuent à examiner. Donc, ça dépend, c'est quoi, comme dire, la tendance pour la propagation du variant Omicron dans les deux plus grandes provinces. C'est quoi les implications si on continue avec le taux de contact dans la population comparé si on augmente à 15 si on diminue à 15 c'est difficile et c'est pourquoi on continue de travailler étroitement avec nos homologues de provinces et territoires pour vraiment, comme dire, viser sur les cas signalés des cas Omicron pour faire un bon suivi des contacts, pour faire nos meilleurs efforts pour contrôler la propagation du variant Omicron, mais ça dépend. Ça dépend. C'est quoi le résultat des efforts? C'est toujours possible que malgré nos meilleurs efforts, on peut ralentir la propagation, mais on ne sait pas, peut-être dans quelques semaines ou mois, on peut avoir une situation complètement différente. Donc, je pense qu'il faut toujours continuer avec l'adoption des vaccins, augmenter la couverture vaccinale et aussi continuer avec nos mesures de santé publique. Je ne sais pas, Dr. Tam, peut-être quelque chose d'autre aussi à ajouter. OK, c'est bon. On répète toujours les mêmes choses parce que c'est toujours les mêmes mesures de santé publique éprouvées et aussi on sait c'est quoi vraiment les avantages des vaccins et c'est pour pousser tout le monde, plus les personnes, peut-être les personnes qui n'ont pas encore reçu même une dose de vaccin, et c'est le temps aussi maintenant de se faire vacciner avec une dose, deuxième dose, et aussi une dose en état admissible. Merci.
Thank you. Operator, next question. Prochaine question.
Unfortunately, we don't have time for more questions.
Is there anyone left in the queue?
We have more questions.
No questions? Okay. Then
we do have more questions. I'm sorry, we're instructed not to take more questions, but we do have more questions.
How many people are still in the queue?
3.
Dr. Njoo, Dr. Tam, are you able to take those 3 questions?
Yes, I'm okay with that. Thank you.
Okay.
Yes.
Operator, next question then, please. And if the questions can be quick and the answers can be quick, then we will not strain people's time.
Thank you. The next question is from Alex Ballingal from the Toronto Star. Please go ahead.
Hey, thanks very much for the going into overtime here. I really appreciate it, you guys. Just on sorry, I think it was slide 17, where it shows the provinces. So the gray line, current levels of transmission, like it looks like Ontario and Quebec are already on pace for this. Quite a resurgence, as you say, that looks even consistent with the Omicron replacement. So am I reading that right, that these two provinces are on pace already, given what's going on now, for this strong resurgence? And if so, does that mean that stronger health measures are needed in these two provinces to get off this resurgent trajectory?
Yes, Theresa Tam. So if you also refer back to some of the slides at the beginning, it shows that Canada's case rates are going up, mainly driven by the 2 largest provinces, and those are cases. And so I think the provinces are also looking at hospitalizations and the other impacts. And if you unpacked the numbers even more, right now, those cases are in the youngest age groups, schools, and daycare, which we subsequently demonstrated. So I think, they've been looking at all of these parameters together, not just the case rates, in deciding what kind of public health measures are reasonable in their context. But I'm just urging extreme vigilance and caution because the Omicron variant could take over pretty fast, and we don't know what the impact is on the severity indicators or on hospital capacities, and that might be different in different jurisdictions. So what you see, the projections there are for cases, but there are other considerations as people take into account their policies, but any escalation in cases could result in more hospitalizations.
And just quickly as a follow-up, I know you guys have been asked this a couple times, I think in French, sorry, it's a blurring in my mind here, but you say small gatherings over the holidays. People should go small. I heard reference to 20, 25 people. Is it kind of a region-specific thing in terms of a cutoff, or what would you guys say, just to be super clear to Canadians who are planning dinner parties and stuff over the next few weeks? What does small gathering mean?
Yeah, so you're right in that we always stress that you should look at the local epidemiology. So if you're doing your personal assessment of what you should do at Christmas, first of all, make sure you know what's happening in your community and know that that could change. So have other plans. If you had one plan, you should maybe have other plans like Plan B, because by Christmas things could look quite different, but plan for different eventualities. Right now with the Omicron variant and some of the knowledge we still have to gain, to be prudent is good to keep, I think, gathering small. And by that, we're not prescriptive. We just said, think about families and your close friends where you know the vaccination status. That is the safest thing to do. But it does depend, as you've seen, it's very different in terms of disease activity in different areas of the country. But I just think that given the Omicron variant, if we can all do our part in reducing the risks of transmission for now, while we're learning things, that will be our collective effort to minimize our risks. I think provinces will have different policies, but I think we can all think of our particular situation, do our best in minimizing these risks. There have been super spreading events with the Omicron variant from other countries. So, and those were different kinds of gatherings, not your family ones, but they're more, but some of them have been potentially, social gatherings. Others are conferences or events like that. So I think anything to avoid a super spreading event is prudent at this point.
Thank you very much. Operator, next question. Prochaine question.
Merci. The next question. La prochaine question est d'Annie Guillemette, Cogeco Nouvelle 98.5 FM. La parole est à vous.
Merci. Bonjour. Ma première question a déjà été répondue. C'est très clair concernant les rassemblements. Qu'en est-il des voyages pendant les fêtes? Est-ce que vous recommandez aux gens, justement, de rester à la maison et d'annuler ou de ne pas réserver de voyages à moyen terme, justement, en raison de la capacité de transmission là, qui semble élevée à l'heure où on se parle?
Merci pour la question. C'est Dr. Njoo. Ce que je peux vous dire, c'est très important de faire comme ce que je peux dire comme une auto-évaluation parce que c'est un peu personnel avec même, comme dit, une seuil de tolérance de risque. Mais on sait que si on est une personne peut-être plus âgée avec des conditions sous-jacentes, peut-être je recommande peut-être fortement, peut-être c'est pas une bonne idée de voyager à l'étranger. On sait que la situation au Canada, c'est pas mal comparé à beaucoup des autres pays parce qu'on a une bonne couverture vaccinale. la plupart de la population, on suit les consignes de santé publique, mais si on voyage à l'étranger, on voit que la pandémie continue à travers le monde et la situation, c'est différent d'un pays à l'autre. C'est pourquoi c'est très important. Si on considère de voyager à l'étranger, premièrement, pour moi, c'est numéro un, il faut être entièrement vacciné. Ça, c'est numéro un. Considérer aussi les autres conditions personnelles de risque, comme des conditions sous-jacentes. Si on va dans des autres pays, il faut aussi être conscient que la situation épidémiologique peut changer dans n'importe quel pays et aussi les mesures de santé publique en vigueur peuvent changer aussi dans chaque pays. Donc, c'est très important d'être toujours au courant avec les mesures, les exigences dans les autres pays. C'est peut-être une bonne idée de regarder c'est quoi la couverture vaccinale dans les autres pays, c'est quoi l'application des mesures de santé publique. C'est aussi c'est quoi peut-être vos plans potentiels pour les activités. Est-ce que vous allez faire des activités peut-être un peu comme isolées des autres, comme la randonnée, ou est-ce que c'est vraiment rentrer dans des situations, des rassemblements avec beaucoup de personnes? Ça fait partie de toutes des considérations et finalement aussi, c'est sûr que si on retourne au Canada, on continue avec avec des mesures à nos frontières. Donc, il faut aussi attendre avec les attentes pour le dépistage, la quarantaine, les autres mesures ici, même à notre frontière ici au Canada pour les voyageurs qui rentrent au Canada. Donc, avec toutes les considérations, c'est pas pour moi pour dire à n'importe qui voyage ou voyage pas, mais il faut être vraiment conscient avec toutes les considérations, tous les risques, même ici au Canada, mais aussi à l'étranger. Merci.
Et à vous. Merci. Operator, last question.
Thank you. Merci. The next question is from Christine Barak from CBC National News. Please go ahead.
Thanks, doctors, for taking our questions. Just quickly, we know that some Canadians are really scrambling to buy rapid tests right now. Do you have any advice on using them? And Dr. Njoo, you mentioned you're having a small gathering. Would you ask people to take a rapid test before they attend or not?
It's Dr. Njoo. I guess maybe I should try. There's a question for myself. I'm sure Dr. Tam has lots to say. Not to get all specifics, we always talk about using the right test in the right place at the right time. And so not to get into all of the details between what we call rapid antigen tests, which have a certain characteristics in terms of what I might call sensitivity, specificity, and then, of course, the molecular tests, which we know also have certain attributes which make it, I would say, maybe at the end of the day, more precise in being able to give a diagnosis. And so for rapid antigen tests, I would say that there are some key considerations because of I would say, the drop-off or the fact that they don't work, I would say, as well as a molecular test, that they need to be used in the very specific situations. I think the minister already mentioned that in certain contexts, if you're doing a sort of regular testing, let's say in certain workplaces, maybe in schools or whatever, there might be a possibility of that being useful. I would say also that, if you're trying to rapidly deal with outbreaks, if you have the beginnings of an outbreak in terms of maybe rapidly identifying what the spread might be in certain situations, then yes, the use of rapid antigen tests. For me, in terms of my personal situation, I think, whether they might have any utility, first of all, I can tell you right now, I fully expect that all of the guests at my family get together are fully vaccinated. And certainly also clear instructions for myself included. We might cancel it because I'm the host. And if anyone's coming down with symptoms or feeling ill, you shouldn't be coming. So that I think is number one. And we certainly know that the rapid tests have a certain use. If you are ill, then it's maybe a quick way to determine whether you might have COVID-19. Obviously, maybe it could be then confirmed by a molecular test. So to me, I guess quite honest, I don't anticipate using them in my personal context because it's really, if you get the greatest deal in terms of determining, if you have COVID-19, if you're symptomatic, my first stance is that if you're symptomatic, you have any signs of illness, no, you shouldn't be coming to my family get together. So hopefully that answers part of your question, but I'll turn it over to Dr. Tam for anything else she would like to add. Thanks.
I would just say that, if you use a rapid test, it should be an additional layer and not not let go of some of the other layers of protection that we've been talking about, and know the limits of the rapid tests. And so that's I think before anyone uses a rapid test, just learn about it and learn what it can or cannot do. And that if you tested yourself today, there are false negatives, but you take that into account. As I said, if it's just part of one layer of protection, that's one way of thinking about it. From a sort of national perspective, this is not a limitless resource either. So I think if you're looking at public health program perspectives, as Dr. Njoo said, there are other considerations, and making sure that we target these tests in the best way possible. For personal use, just make sure you know that these tests are not perfect. And if you think you need to get another test after the serial testing can reduce false positives as well. So you should take into account your personal context and what kind of gathering you're having, who's there, etc. But it shouldn't be seen as a substitute for the other layers. Thanks.
Yeah, it's Dr. Njoo, just to add to what Dr. Tam said. I think it's another layer of protection. So it's a bit of a shout out to, I guess, the family and members are coming over for our holiday get together. Bring some additional layers of clothing, because I plan to also use ventilation to the max and have the windows open for a certain period of time, maybe on the hour, to also improve the circulation of air. So that's maybe a bit of a warning to my family members who are coming over. Thanks.
Thank you both so much. You've answered all my other questions.
Thank you so much. Bye.
Thank you to Dr. Tam and Dr. Njoo for taking so much time to answer all of our questions. And the more answers that we're able to provide, the more people are aware of what the facts are in this. Thank you very much. And this puts an end to this press conference.
Thank you.
Bye.